The first U.S. patients to get the COVID-19 vaccination could actually get that within days, depending on how quickly the FDA approves the Pfizer vaccine. And we're joined now by Dr. Amish Adalja, the senior scholar at the Johns Hopkins Center for Health Security. Doctor, you have been on the front lines of this thing for months. I'm wondering what you're thinking tonight personally, being this close.
I think that probably if I'm talking to you a week from today, hopefully I'll be someone who's already received their first dose of the vaccine. This is what we were waiting for. But again, it's not going to be a panacea because it's going to take some time to be able to control this infection, which is all over this country. We're not going to see benefits in terms of hospital capacity immediately, but I do think that this is ultimately how we will control this. And it is a remarkable feat to have a vaccine for a virus that was discovered less than a year ago. And I think that really is a testament to the new technology, the scientists, and I would also say Operation Warp Speed to allow this to happen.
So people have been saying, I can't wait for the vaccine, but now that it's here, it seems like a lot of people are saying you first.
I'm happy to go first, and hopefully I will be in that first tier because I am a healthcare worker. I know there's lots of people that have hesitancy about this vaccine and the fact that it came out so fast, but you have to remember that this is using new technology that didn't exist. So that's how we were able to start the clinical trial so fast. And it wasn't that safety was compromised or cut. This actually looks like a very, very safe vaccine when you look at the preclinical studies, phase 1, phase 2, phase 3, and this is something that I'm happily going to roll my sleeve up next week for.
We asked viewers for some questions, Doctor, so let's start with William Pierce, who asked, should a frontline person who's working with a physician's program to become pregnant dare take the vaccine when there's no data protecting the conception? There are a lot of pregnant women who are asking about this vaccine.
So in the clinical trials, pregnant women were not included, although some trial participants did become pregnant, and it seems that there were no complications, but they're still studying that to get a definitive answer. So we are going to not give this to pregnant women, at least in the first tier. So those individuals are going to have to wait till we get more data before it is recommended for pregnant women. I suspect it likely will be safe, and I think it's important that we actually include pregnant women in these studies because there are many pregnant women that work as healthcare providers that are going to be high risk, and we want to get the vaccine into anybody that could benefit from it.
Cheryl McDonald asked the next question, Doctor, and she says, I have so many allergies. If I don't know what is exactly in the vaccine, I can't risk it. What would you say to Cheryl?
So we did see 2 reported severe allergies in the United Kingdom and 2 healthcare workers that had been prescribed EpiPens because they had a history of severe allergies. We're going to get more information on that, and that's going to probably come with the CDC ACIP meeting on Sunday about how to handle this severe allergy group. And it may be that people who have allergies that are severe enough that they go into anaphylaxis, that they need an EpiPen, to drugs, to vaccines, to other medications and foods, they may be excluded from this first tier of vaccines until we actually understand what happened in the United Kingdom, what the cross-reactivity was in the Pfizer vaccine to what those 2 individuals were allergic to. This doesn't mean that if you've got seasonal allergies, hay fever, or you're allergic to cats or dogs, that's not what we're talking about. We're talking about people that have to walk around carrying an EpiPen.
So I didn't get a name on this one, Doc, but another viewer says, if you want to visit your parents for Christmas, and a lot of people are pondering their Christmas plans, should you isolate or quarantine for 7 days, 10 days, 14 days? Also, what about testing?
So if you are going to be around vulnerable populations for Christmas, you need to take maybe 2 weeks prior to that and start closing your circle, decreasing your contacts, and being very careful about what activities you partake in. Testing can help. It can decrease the risk, but remember, it's not ironclad. We saw what happened at the White House with the Amy Coney Barrett ceremonies and the hotspot and super spreading event that happened there because people overly relied on tests. So one test means one moment in time that you're free. So it's one thing you can do to reduce the risk, but don't let it get a false sense of security just because one test is negative. Serial testing is a different story, but that's much harder to get, at least in the way we are in the United States with testing scarcity.
Dr. Amish Adalja, senior scholar at Johns Hopkins, you have been a wonderful resource for us as we've navigated these waters over the last few weeks and months, and we appreciate your time again tonight.
Thank you.